tell me about the linkage program that you've started down at the Palo Alto Medical Foundation.
Linkages we started as a way of, we're creating a system to help people age in place in the community and trying to find out what gets in the way of living independently. About half of the seniors, about 43%, are lonely. What's the implication?
43%.
43%. Turns out people who are lonely have 45% increased mortality at 6 years compared to people who are not. So you can see how that's going to contribute not only the human cost of what it does to the individuals and the family around them, but the healthcare costs and even the nursing home costs in the future.
How does an individual actually interact with linkages?
We're starting out at the Mountain View Senior Center. It's sort of the hub, targeting about 200. We call them micro-communities.
Right.
They're going to interact through a system that we're actually developing. It's a web-based system, so they will interact with the system that connects people with, let's say, someone who can provide transportation with someone who's interested in going to a garden exhibit. It'll stimulate your interest in the things that you used to do that you thought you no longer could do. It's a social network specially designed for seniors and caregivers. One of the components of linkages is signal detection. Signal detection is, you might think, oh, it's blood pressure, it's glucose, but we're thinking also of human signal detectors. Certainly your family notices when something's changed.
Right.
But also the person who delivers Meals on Wheels, even the postman or the FedEx exchange person can know something's changed. They need a place to let somebody know so that we can get you the help. So we had a developer challenge and said, can you help us detect signals at home?
And how many people actually participated?
There are 400 people who participated, about 100 developers. We even had people from across the country come.
What's the response been from the individuals that you've connected with thus far?
Well, they're very excited that Sutter Health is doing more than just taking care of them when they get sick and in the hospital, that we're reaching out to them in the communities and saying, how can we make life better?